We have special guests with us today who are the authors of the Barrington Declaration, the Great Barrington Declaration. Our first guest is Dr. Martin Kulldorff and Dr. J. Bhattachara. They are co-authors of the Great Barrington Declaration, which describes an alternative approach to COVID policies called focused protection that seeks to protect the most vulnerable while avoiding or minimizing the societal harm of COVID-19 lockdowns. Now, these guys are a couple of fringe maniacs. He's Dr. Kulldorff is a professor of medicine at Harvard University, never heard of it, a biostatistician and an epidemiologist with expertise in detecting and monitoring infectious disease outbreaks and vaccine safety evaluations. Dr. Bhattachara is a professor of Stanford University Medical School, never heard of it, a physician, epidemiologist, health economist, and a public health policy expert focusing on infectious diseases and vulnerable populations. Doctors, thank you so much for being with us.
Thank you, Jimmy.
So I just wanted to, you guys are very dangerous because I want to let everybody know I've been showing this on the show before. This is from the Wall Street Journal, and the title is How Fauci and Collins, now you know who Fauci is, Collins was the head of the NIH, how they shut down COVID debate. And the subheadline is they worked with the media to trash the Great Barrington Declaration. And in public, this is from the article, Anthony Fauci and Francis Collins urge Americans to follow the science. In private, the two sainted public health officials schemed to squash dissenting views from top scientists. And how did they do it? Here's an email. From Francis Collins from the NIH to Tony Science, as we call him, Tony Fauci. It says this proposal, this Great Barrington Declaration, from three fringe epidemiologists who met with the secretary seemed to be getting a lot of attention, and even a co-signature from a Nobel Prize winner, Mike Levitt at Stanford. There needs to be a quick and devastating published takedown of its premises. I don't see anything like that on the line yet. Is it underway? And within 10 minutes after receiving that, Tony Fauci said, yes, I am pasting below a piece from Wired that debunks this theory. So let me just bring in, on here, and you tweeted about it. You said a year ago, the NIH director, Francis Collins, asked Fauci to do a devastating published takedown of the Great Barrington Declaration of public debate. Public debate would have been better, invitation still open. Now, Dr. Kuldorf, why do you think Dr. Head of the NIH and Dr. Fauci were so worried about you that they had to smear you?
Well, the lockdowns has been the biggest assault on the poor and the working class since the segregation and Vietnam War. And it has led to unnecessary deaths, both in COVID, because people thought that we could, by locking down, we would protect the old, but obviously we wouldn't, because it would just postpone things if you lock things down. So we didn't properly protect older, vulnerable, high-risk people, and too many of them died. At the same time, there's no public health reason to keep schools closed, because even though anybody can get infected, the probability of dying from COVID, there's more than 1,000-fold difference between the oldest and the youngest. So for children, there's a minuscule risk from COVID. And the damage from keeping the schools closed has been enormous, and especially for working class children whose parent can't afford them to put them in private school or hire a tutor or do a post-school or homeschooling.
And so, Dr. Bhattachara, why would Anthony Fauci and the head of the NIH not want to have this discussion? Instead, why do you think they would bypass the real debate and go right to slandering you and your work?
I mean, we posed an enormous problem for them, Jimmy. The problem is that they wanted to create this illusion that all the scientists in the world, all the doctors in the world agreed with this lockdown policy. They wanted to, it was basically a propaganda campaign. They wanted to create that tell the public, no, we are the science. Rather than facing the inconvenient fact that many scientists disagreed with them. The Great Barrington Declaration, when we wrote it, the three of me, Martin, and then Sunetra Gupta of Oxford University, we posed an enormous problem for them because they couldn't simply just really dismiss us as fringe. They wanted to, and they, you can see that they did. But the reason is simple. It's like, if there are prominent scientists who disagree with them, well, that must mean there's lots of other scientists that disagree with them as well. In fact, there were thousands, tens of thousands of scientists and doctors signed on. And that's why we pose a problem. Not because of the science. They can't defend the science of the lockdown, but because of the PR.
So, but what I don't understand is why do you think that Dr. Fauci and the establishment were so wedded to this lockdown policy? Why weren't they open to changing their policy and doing something better?
I mean, I think the part of the problem is that it was October 2020. We'd already had a lockdown that had kept poor kids out of school, that had devastated the poor around the world. The UN was already estimating hundreds of thousands of dead children in poor countries from starvation, tens of millions of people thrown into poverty. That was already baked in the cake. If it was true that there was actually opposition to the lockdown in the scientific community, well, then they made a grave mistake. It's very difficult for people in that kind of powerful position to admit they'd made a mistake that had devastated the lives of so many of the poor and the working class.
So that's the thing that's been scrambling my brain, is that I understand that scientists and doctors disagree all the time, which is why whenever you have a diagnosis, you're supposed to get a second opinion and even a third or fourth opinion. I had a disease. It took me 15 opinions to find out what was actually wrong with me. So that's why that's just how science works. But seemingly everything got turned on its head, and anybody who questioned anything was seen as a heretic. Did you? I mean, obviously you experienced that because you were tried to be smeared by the guys in charge because you had a different point of view, and you think it's just because they didn't want to be proven wrong about the lockdowns that they wouldn't let you you couldn't talk about the origin of the virus. It might have came from a lab before. You'd get taken down from YouTube and called a crazy conspiracy theorist by PolitiFact and factcheck.org. They would say you were a crazy conspiracy theorist if you questioned where the virus came from, or if you questioned the efficacy of cloth masks, which they now agree is much less than they thought it was. If you anything, or how much it would take to get to herd immunity, any of those questions. Why do you think that happened too? Why do you think it's to a point where anybody who questions the narrative is immediately called to be censored and made out to be a crazy person?
So the focus protection and the Great Barrington Declaration is based on long-standing basic principles of public health that we have followed for decades. Lockdowns is a new experimental thing. So the problem for Dr. Fauci and Dr. Collins is that they don't really have any good public health arguments. And Collins is a geneticist and Dr. Fauci is an immunologist. So their experience of epidemiology and public health is very limited. And you could see that from this email where Fauci was quoting Wired magazine as a takedown of the Great Barrington Declaration. So they don't really have any good public health arguments. There was no public health arguments to keep the schools closed. So the only thing that remains then is to use slander or smearing or mischaracterizing your opponents. And that's what they did. They called focus protection a let it rip strategy, even though it's the very opposite of protecting the vulnerable and the high-risk people. But that's the only thing they have, is sort of a media propaganda campaign of slandering and mischaracterization.
So and of course you've all been mischaracterized as being anti-vax, and of course you're not anti-vax. Of course you believe in not believe, but through the evidence that the vaccines actually are helpful to lots of people and they save people's lives, correct?
Can I brag a bit about Martin?
Older people who haven't had COVID should certainly no-brainer take this vaccine. And to call us anti-vaccine, I think, is actually very anti-vaccine to do that, because it gives credibility to the anti-vaccine movement if Fauci or CDC or others or journals like British medical journals are falsely claiming that professors at Harvard, Stanford, and Oxford are against vaccines. So actually the opposite is true. Sunita Gupta, the third author of the Great Barrington Declaration, she works on developing vaccines. I have worked a couple of decades on evaluating the safety of vaccines. And actually, I think I'm in a unique position because I think I'm the only person who has been fired by CDC for being too pro-vaccines, which happened about a year ago.
Really? Okay, that's interesting. So go ahead, Dr. Bhattachara, you want to say something?
I was just going to brag about Martin. Martin designed the system, one of the systems that the CDC, or helped design one of the systems the CDC uses to track the safety of vaccines. Well, not just COVID vaccines, but lots of other vaccines as well. He won't brag, so I'll get out to do it for him. And he's right. He was fired by the CDC. Remember last year they paused the Johnson & Johnson vaccine for a week and then brought it back. Martin wrote a thing saying there wasn't enough evidence to do the pause, and for that, because he dissented against what the CDC was saying, he was fired by the CDC. And somehow the opponents of this, the people behind this propaganda campaign, have made it look like, made it say as if we're against the vaccine. That's just a straight lie, Jimmy. We have been big proponents of using the vaccine, especially for focused protection. Older people, it's saved, I believe, I don't know how many lives of older people. If it had been deployed more effectively around the world to vaccinate older people everywhere, not just in rich countries, I don't know how many more lives would have been saved.
So focus protection. So let me just read a little bit from the Great Barrington Declaration. Okay, this is current lockdown policies are producing devastating effects on short and long-term public health. The results, to name a few, include lower childhood vaccination rates, worsening cardiovascular disease outcomes, fewer cancer screenings, and deteriorating mental health. Now, that's important because I know my own dental hygienist couldn't get in to see her doctor because when she thought she had breast cancer, it turned out she did, and they didn't get to discover it until it was already at stage 4. And she would have got in a lot earlier anyway. So that's what you're talking about there. Fewer cancer screenings and deteriorating mental health, leading to greater excess mortality in years to come, with the working class and younger members of society carrying the heaviest burden. Keeping students out of school is a grave injustice. As immunity builds in the population, the risk of infection to all, including the vulnerable, falls. We know that all populations will eventually reach herd immunity, i.e. the point at which the rate of new infection is stable, and that this can be assisted by, but not dependent upon, a vaccine. Our goal should therefore be to minimize mortality and social harm until we reach herd immunity. Keeping these measures in place until a vaccine is available will cause irreparable damage, with the underprivileged disproportionately harmed. Fortunately, our understanding of the virus is growing. We know that the vulnerability to death from COVID-19 is more than 1,000-fold higher in the old and infirm than the young. Indeed, for children, COVID-19 is less dangerous than many other harms, including influenza. The most compassionate approach that balances the risks and benefits of reaching herd immunity is to allow those who are at minimal risk of death to live their lives normally, to build up immunity to the virus through natural infection, while better protecting those who are at higher risk. We call this focused protection. So that's what I had Dr. Robert Malone on my show a couple months ago, and he recommended the same thing. Now, and correct me if I'm going to get it wrong, is that you protect people who are elderly, you protect people who have comorbidities, you protect the obese, but you don't vaccinate the completely healthy and certainly not children. And when they get the virus, they'll build up immunity to it. And they'll also, the virus, when it mutates, will mutate to become more contagious and less deadly. Now, is that all correct, what I said?
I guess, I mean, I personally would think if a younger person wants the vaccine, you can let them have it. But I certainly should never force it on anybody. And we should certainly give everybody complete information about the risks and benefits of the vaccine. But it is most critical to protect older populations. They face so much higher risk if they get infected from this disease, and so therefore the first priority should be to protect older people. We wrote this in October of 2020 before the vaccine, but certainly after the vaccine, to use the vaccine on these older people, even with the uncertainty about the side effects, because it's protecting against such a bad risk, it's worth it. Normally in any medicine, you compare the benefits versus potential side effects. There's still a lot not known about the vaccine. It's a relatively new vaccine, But that uncertainty is outweighed by the enormous benefit to old people. For young people, it's much closer. And I'd say if people want it, they can have it. But the priority should be using it to protect older people.
Older people meaning people over 60, over 70. How old?
I don't say that. I don't think there's a firm drawing line. The way to think about this is, roughly speaking, I'm 53. No, I'm actually exactly 53. But roughly speaking, it's 0.2% mortality risk for a 53-year-old, right? So if this was before the vaccine, before Omicron, so 99.8% survival for me. For every 7 years of age above, you double the risk. For every 7 years of age below, you have the risk. So a 60-year-old would be 0.4% mortality, so 99.6% survival. These data, by the way, come from hundreds of studies done around the world and published by the World Health Organization. This is not anything radical or fringe. This is actually sort of straight mainstream science. I could be talked into saying 60-year-olds as a threshold. I could be talking to 50. It's not a firm point. It's a principle. So some countries may decide to say, okay, we're going to prioritize everyone over 70. 80% of the deaths are people over 65 in the U.S.
Real. And so I saw a stat the other day that said the average rate of death, the average age of death from COVID is over the age of life expectancy. Is that?
That's true. It's 80. I think in the U.S. is 80 or 79.
So this is the thing. So this is, my show has been pushing back against mandates and pushing the Great Barrington Declaration, what you've been pushing ever since I talked to Dr. Robert Malone. And I don't understand how you can be for a mandate after you have this information that first, the vaccines do not prevent transmission. They do not prevent contraction. They might reduce it. But now everyone knows that everyone is going to eventually contract the virus, likely, correct?
Yes.
And so now how can they justify mandates if everyone's going to get it? The point of a mandate is to protect you from someone else who gets it. But if you're going to get it anyway, who does it matter who you get it from, a vaccinated person or an unvaccinated person? Because we know a vaccinated person sheds the virus too. And when they're infected, they have just as big a viral load as a person who's unvaccinated. So how can they, my question is, how do they justify those mandates? Or are they just completely ignoring this science?
I think they're ignoring basic public health because I think these mandates are unethical. You shouldn't mandate a 25-year-old college student to get vaccinated who have already had COVID, so they already have the immunity. They're at low risk even if they didn't have had COVID. But then there are people in India or Nigeria or Brazil who are 75 years old and they can't get the vaccine because there's not enough supply. So so these mandates, they actually are hurting people in other countries who need these vaccines because they're in older age groups. So it's unethical to force young people in the US and Western Europe to get vaccinated when there are older people in the rest of the world who needs the vaccines to increase their rate of survival.
I had a cousin and an uncle, both over the age of 70 in India, that died because they didn't have the vaccines in time from the Delta surge in April last year. I think it's not just what Martin said, which is absolutely true. These vaccine mandates have denied older people the vaccine worldwide, but it's also that the mandates have been used to destroy the lives and livelihoods of countless people right here at home. People who served as they were firefighters or nurses or truck drivers or whatever, working throughout the whole pandemic before the vaccine, even if they were older. Many of them got COVID, and now a lot of them have lost their jobs because they didn't want to get a vaccine they didn't really need, or they weren't convinced it was worthwhile for them. It's a cruel thing that we've done with the mandates. We've created a whole class a whole set of second-class citizens, not on the basis of any scientific reality, but just simply because. I mean, I can't. You asked the question why. I can't actually explain why. It must be, if I'm being charitable, a misunderstanding about immunity. A lot of the government documents that justify it pretend as if getting COVID and recovering doesn't confer immunity. And that just is not based on scientific facts. And it's also based on this incorrect idea that the vaccine stops transmission. It just doesn't. What you said, Jimmy, is 100% right. The vaccine does not stop transmission. And so given that, what logic is there for the mandate? There isn't any. It's just cruel and unethical.
Yeah, the natural immunity you get after COVID recovery, it's much stronger than the immunity you get from vaccines. So therefore, there's no rationale to force people who have already had COVID to get the vaccine. And it's pretty stunning as a scientist that suddenly, after having known about natural immunity for 2,500 years, since the Athenian plague in 430 BC, suddenly we don't understand that if you recover from a disease, you have immunity. So it was completely predictable that natural immunity will be stronger than vaccine immunity. It would be extremely surprising if it wasn't. But of course, now also we have multiple studies that shows that. There was one of the first studies was from Israel, showing that those who have vaccinated had 27 times higher risk of having symptomatic infection compared to those who had a prior COVID disease. So natural immunity from having recovered is very, very good. And that's also what's going to end this pandemic when enough people have had COVID so that sufficient people have natural immunity.
So that's unbelievably frightening to me to hear that, because I've heard other people say similar things like we've known about natural immunity for thousands of years. And all of a sudden, when it came to COVID, the government and the establishment were saying something that's completely backwards. Like, oh, vaccine gives you better immunity or than having the natural immunity. And so how could that, did they, here's my thing, did they really think they were going to get away with that? Because it doesn't, as you're saying, everybody learns this first day immunology school class or whatever you call it. And yet they were going against what everybody knew in science. And this is what's still blowing my mind. Like, how did they think they were going to get away with that? Eventually, someone was going to do a study about Corona itself, which they did. And now we know for sure, like you just mentioned. What made them do that?
The World Health Organization actually even changed the definition of herd immunity to pretend like natural immunity didn't count. When we, wow. It's kind of a weird power that we had. We released this, and then we made the World Health Organization stupider, because they needed to say that what we said in the Great Barrington Declaration, which is that both vaccine immunity and natural immunity would contribute to herd immunity. They needed to erase herd immunity, natural immunity from that equation. And say only vaccines can create can create herd immunity. It's absolutely shocking to me. And you asked the question, what did they think they could get away? I actually think they thought that, Jimmy. Right after we published this, there was a group of scientists, I think called for by Fauci and Collins, and based on that email you read, I is what I infer at least. A group of scientists published a letter in the Lancet, which is a very, very prominent, well-known medical journal, saying that called the John Snow Memorandum. The premise was that there's no herd immunity possible because there's no natural immunity. There's no immunity after COVID recovery. And 100 prominent scientists, including the CDC director, signed that letter. Wow. The current CDC director signed that letter. It was completely anti-science, and yet so much of the scientific establishment signed on.
And now, different people make the argument that, well, that's because Fauci controls so much of the funding that goes to universities and people who do research. And so they have these kind of controls over people, and that they could get those people to go along signing a document that was obviously not true and 100% propaganda that seemed to be doing the bidding of big pharma. And is that how they got them to sign that? Why would those people sign that?
So I've spent 20 years with NIH funding. That's where I've gotten most of the support for my work. It is really difficult if you're a scientist and you don't have NIH funding to get your work, in front of people. And a lot, I don't know that people tell themselves explicitly, oh, if I don't sign, then they're gonna nix me. I think it's one of these things where, like, you tell yourself a story oh yeah, that must be true because everyone believes it. And of course, it happens to be in your interest to go along. And you know, only fringe characters wouldn't. And you know, it's strange because I spent a career in science where I thought, I mean, it's been actually a good career. I've said found controversial things. I've had good conversations with other folks who engage with me, and we learn from each other. That's what science is like generally. During this pandemic, if you said something that wasn't in agreement with what like Fauci and Collins are saying or thinking, you get canceled in science. You get sent to the edge. And I think a lot of scientists saw that and reacted just by either by silencing themselves or pretending that the things they knew weren't true, like natural immunity. I think so. It's hard. I don't know exactly the answer to your question because it's. I think each scientist is different. But I will say this: many scientists have reached out to me after the Great Barrington Declaration, telling me that they kept quiet because they were scared to speak up.
Yes, because I've had people argue to me that, oh, Jimmy, do you think that every doctor in the whole world is being suppressed and threatened and it's a big conspiracy? And I'm like, well, I guess you just don't know how these things work. And, you know, just like the media in the United States, you know, there's only 5 companies. The people don't realize that they're all owned by the same people and that they all serve the same interests, just like Republicans and Democrats serve the same donor class. And they don't. So that's very easy to pull off. And for instance, I first started to become skeptical of the narrative coming from the establishment around COVID because I got the vaccine. I couldn't wait to get it because they told me it was going to protect me from getting it and for COVID-19 in the first place, and I could get back to my life. And neither of those things were true. Those were both lies. And then I got injured by the jab. I didn't get better. I was sick for months, right? I had waves of exhaustion, flu-like symptoms, headaches, stiff neck, the whole thing, and it would never go away. And so I got entered into a study, and the doctor that was leading the study was trying to figure out how to treat people with long COVID. And he had a theory that people who got injured by the vaccine also would present as if they had long COVID. And so he did blood tests on me, and I presented as if I had long COVID, even though I never had COVID. I got it from, he said he thinks I got it from the vaccine. So they entered me into a study, and they had they were experimenting with different drugs. One of them was ivermectin. And I said, hey, that's that horse paste drug, you know? And he said, no, that's propaganda. This is considered a miracle drug up until COVID. They were even looking at it to treat cancer. And I was looking at him like I was talking to a Martian. I'm like, because everything I've heard has been, and he said, Jimmy, believe me, this is propaganda. And, you know, they can't have ivermectin out there as something that could treat it. And that's what he was saying. So once I knew they were lying about ivermectin, that ivermectin wasn't an animal medicine, that it actually was on the WHO list of essential medicines that had been prescribed billions of times and saved millions of lives, I was like, what else are they lying about? Well, and then finally, Joe Rogan, a guy who announces guys fighting in cages, embarrassed the doctor from CNN and got him to admit that CNN and the establishment were lying about ivermectin and that they shouldn't have called it a horse dewormer. And Rachel Maddow doesn't stop. Here's Rachel Maddow. She says patients overdosing on ivermectin are backing up rural Oklahoma hospital. And by the way, this tweet is still up. That's 100% lie. But if you lie in the direction that Big Pharma wants you to lie, you'll never be punished. You'll never be censored. You'll never get a strike from YouTube. So you could lie all you want. You just can't tell a truth that the establishment doesn't like. Because I got in trouble on YouTube for telling the truth. I didn't get in trouble for YouTube or not. I told the fucking truth on YouTube, and YouTube doesn't want me to tell those certain truths. They have their own certain truths that's not based on anything. But they'll leave stuff like this up, and they'll leave up videos. Here's when they talk about vaccinating children, NBC News just lies and makes up numbers. And I'm going to play this for you.
Let's bring in NBC senior medical correspondent, Dr. John Torres. Dr. Torres, good morning to you. As Kathy mentioned, that new poll finds about 2/3 of parents are hesitant to get their kids the shot. What is your advice to alleviate some of their concerns?
And Joe, you're right. There is that hesitancy to get the shot, and it's a hesitancy that parents typically have because they're very protective of their child. A couple of things I tell them is, one, from a community perspective, children right now are 25% of the cases that are out there. That's from a community perspective, but parents are more worried about their own child. So here are some numbers for their child. Last week, 118,000 children ended up with Pfizer. Since the pandemic, over 8,000 have been hospitalized, a third of those in the ICU, and unfortunately, there have been 146,000 deaths, which according to the American Academy of Pediatrics, puts COVID now in the top 10 causes of death for children.
So that's what they have to do because 2/3 of the parents in the United States are hesitant to get their children vaccinated. So they have to get a guy who's on the take, who dresses like he's going to go be a lumberjack, but he really is a professional propagandist. And what he just did was lie.
That was a straight up lie. 100 times more deaths. That's not true that 100,000 children have died from COVID in the United States. That's just false.
To 100%. And he goes on to try to scare you even more. Watch this.
So I would say, look at those stats because it's important to understand that if your child gets COVID, that could be devastating with lifelong consequences. And so the vaccine itself proven to be very safe in the trials. The trials looked at them extensively for months. There were no side effects. And we know side effects occur in the first couple of months. And so that long-term concern is very theoretical. And if it happens, could be very rare at the most, but side effects from COVID itself could be devastating. So again, Joe, the main thing is.
So he just said there are no side effects. He said there were no side effects from the vaccine. Also a lie. So those are two lies back to back. And when they put that video up on YouTube, which is still not taken down, it got 5,000 dislikes to 500 likes. So that's why YouTube stopped showing dislikes, because every time they did a news report about COVID or the vaccines, it got downvoted and Big Pharma put the pressure on them and they changed it. That's my theory. What do you say about this culture we're living in now, where everyone's flex is to censor somebody who goes against the establishment narrative, even though the establishment narrative has been proven to be a lie over and over and over again. And people think Joe Rogan's the problem, and they don't think NBC is the problem, or Rachel Maddow is the problem, or Rolling Stone is the problem. What do you say to that?
It's a mark of honor that we all three of us share in common, Jimmy. Each of us have been struck from YouTube for something or other. Mm-hmm. In fact, I think if you don't get out of this pandemic without being struck from YouTube, you're doing something really wrong. That is, you're not telling the truth. I think that report you just showed was absolutely shocking. It was it was filled with absolute lie. So, for instance, another lie was that COVID has long-term effects on children. Well, there was just a study today published in the European Journal of Pediatrics, and the study is an enormous study of COVID in children. It's found, and here's the conclusion: long COVID, that is long-term consequences of COVID in children, is rare and mainly of short duration. Now, normally you don't tell jokes in scientific papers, but that is funny. Long COVID is of short duration.
That is funny. I missed it. I missed it the first time.
I think this is one of these things where they're creating this sense of panic in parents, and it's just evil, because what happens is then parents make decisions for their kids that end up harming the kids on the basis of this false information. They keep kids home from school when they should be going to school. They do all kinds of things to create anxiety in children. 1 in 4 young adults and seriously considered suicide in July of 2020 in the United States. The anxiety rates, depression rates in children are through the roof. There's a 50% increase in suicidality among adolescent girls in the U.S. during the pandemic. We've created this anxiety around children that is just not warranted based on the facts about how COVID affects children. It's an absolutely disgusting use of the power that the media has. And so,
what do you think we can do about the phenomena in the culture now, that if I present someone with a fact like this, like kids are at low risk from COVID and you should have them go to school and you shouldn't have them wear masks, stuff, if I say something like that, they will look at me like I'm a Nazi. They will look at me like I'm every bad thing in the world, that I'm selfish, I'm a grifter, I'm a liar, I don't care about kids, I'm a Trumper. I'm every bad thing in the world if I present them with an actual fact that goes against their narrative. And how have you experienced this, and how do we get out of this?
Well, I think it's very natural that the public would believe somebody like Dr. Fauci, the head of the National Institute of Allergy and Infectious Diseases. Sort of why? Because why would he not tell the truth? And I don't know why he doesn't do it, but he doesn't. So it's natural that people believe him. But I think now it's obvious to more and more people that vaccine doesn't prevent you from getting the disease. You will get it whether you're vaccinated or not. The vaccine's benefit is to reduce the risk of death for those who have a high risk of death from COVID. So I think that it's natural that people believed him, but now when the whole thing are falling apart, I think it's time to people open their eyes and realize that for one reason or the other, Dr. Anthony Fauci basically fooled America. When he was arguing that schools should be closed, that was nonsense, not public health. So, and we can see, for example, from Sweden, and we knew that early on because even on in the spring 2020, first wave, Sweden was the only major Western country who kept schools open for all kids ages 1 to 15, daycare and school. And among 1.8 million children, there were exactly 0 deaths from COVID. And that was without any mask, without social distancing, and without any testing. If a kid was sick from whatever thing, they were told to be home, but that was the major countermeasure. So we knew already in the summer of 2020 that it was safe for kids to be in school, and the teachers in Sweden didn't have any higher COVID rates than the average of other professions. So we knew it was safe for children, and we knew it was safe for teachers. But despite that, New England Journal of Medicine I think it was in July, it was in the summer of 2020, they sort of wrote a review paper about the safety of having schools opened, and New England Journal of Medicine didn't even mention Sweden as an example. And that's like doing a clinical trial for a drug and not report what happened to the placebo group.
So speaking of the placebo group, so they're supposed to have a placebo group for a long-term study on the safety and effectiveness of the vaccine. They got rid of the placebo group. Can you explain why they did that and how that screws things up?
Yeah, so that's a problem because for the vaccine trials, they gave the vaccine and then they gave like a needle without any vaccine as the placebo. So it was blinded, which it should be. And that's how they found that there were over 90% efficacy for reducing symptomatic disease within the first couple of months after the second dose. At the time, those trials didn't show anything about reducing transmission, and it didn't show anything about death. So it showed symptomatic disease. Luckily, it also prevented death. But then they basically offered the vaccine to everybody in the placebo group. And that's a problem from a scientific point of view because that makes it difficult to compare long-term effects of these vaccines, both in terms of efficacy and safety. And I think that was a mistake to do so. Maybe they should have done it for the very oldest people who got the placebo, but I think it was a big mistake to do it for other members of the trial. That should have continued because we still didn't know the efficacy and safety long-term. So it would have been the ethical thing to continue that trial.
Is that suspicious to you that they did that?
Yes.
Like it does that they were supposed to keep a placebo group and they just decided not to. And the reasons they gave were they were worried about these people. Is that the reason?
That's the reason they gave that. Look, we think that the vaccine prevents death, and we shouldn't. It's not right to have a placebo group who is not protected against death. But the problem, like as Martin said, the trial didn't show that the vaccines prevented death. The trial showed that it prevented symptomatic disease. It's not the same endpoint as death. And the scientific benefit of knowing the long-term safety and efficacy of the vaccine would have been enormous. Like on the basis of that trial, I personally thought that in January 2020, that the vaccines actually did prevent infections. Now, that turned out to be false, because the reason is after 4 months, 3-4 months after the vaccine, the protection against infection drops very sharply. Well, that was outside the window of the trial, so we didn't see it in the trial. I think the scientific benefit of extending the trial, allowing it to continue without unblinding and vaccinating control arm would have been enormous. And I think on net it was unethical to do that, because the scientific evidence, the evidence we would have gotten from that extended trial would have been useful to know, affecting the lives of literally billions of people.
And so we've been trying to discover what the real death rate is. So Bill Maher brought this point up to his mainstream audience, which was that people who voted Democrat are overwhelmingly for the vaccine, boosters, lockdowns, all that stuff. But they also overwhelmingly have misinformation about the threat posed by the COVID-19. In fact, they all thought that if you got COVID, you had a 50% chance of going to the hospital. And according to Gallup, you have a 0.89% chance of being hospitalized if you catch COVID. That means if you're unvaccinated. If you're vaccinated, even lower, 0.02%. So very low. So this one, both of them under 1%. Now, most people thought, like I did for sure, I thought if I got COVID, hey, I was going to die and I was going to for sure have to go to the hospital. It turns out 0.89% of the people who get COVID, that includes everybody, old people, young people, obese people, comorbid, everybody who's unvaccinated who got the virus, 0.89% of those people would end up hospitalized. Now, that information does not get circulated, but what else for sure doesn't get circulated is what the real death rate is. Could you speak to what the real death rate is? Because they said it was 3.4%, and everybody's been using that number. And I'm like, well, if the hospitalization rate is 0.89%, how could the death rate be 3.4? So please explain it to us.
So I actually happened to run a study in the early days of the epidemic to check how many people had been infected in Santa Clara County, where I live, and LA County, where you all live. It turned out that in April of 2020, about 4% of LA County was infected. Now, how do I know that? Because in the study, we checked for antibodies in the blood. So even if you didn't show up to the doctor, even if you had a mild disease, you thought it was a cold, you had antibodies that were specific to the virus, we'd find it. And 4% of LA County, that was 40 times more infections than cases in the early days. If you calculate the death rate from that, it turns out it was about 0.2%. That from the earliest versions of the virus. So 99.8% survival, with this huge gradient where older people are much more likely to die, young people very, very, very unlikely to die. No young people had died actually at that point. No children had died at that point. So we knew from the early stage of the epidemic that 3.84% number put out by the World Health Organization was a vast overestimate. They knew that there were lots of people who'd gotten the disease that weren't in the denominator of the, death rate is how many people died divided by how many people got the thing. And they were just looking at the people that showed up at the hospital with the disease. And of course, the people showing up at the hospital have a higher death rate, but there are lots and lots of people. It's like a big iceberg of people that no one was seeing that had got the disease and recovered just fine. And it is a deadly disease, especially for older people, but it is not nearly as deadly as the media has made it out. And it's no surprise to me that people overestimate it, because what are they looking at? They're looking at people that they trust telling them, like the World Health Organization, Tony Fauci, the news media, that it's like the Black Plague. It's just not.
And so you would say a good number for the actual overall death rate would be 0.2%?
That's before Omicron. Omicron is probably 10 times less deadly than that.
So it's probably an even lower number now.
Yeah, if you're gonna do survival rates, be like 99.8% before Omicron, 99.98 after Omicron. I mean, it depends on the country you live in. So if you're living in a country that's very, very young, like the continent of Africa, 3% are over the age of 65. They have a very low death rate from this. Whereas the United States is a little older, we have a higher death rate from this. So it's not just simply like, it's not just the virus itself. It's how old there's lots of other factors going to it. But you're going to run out of nines when you talk about the survival rate for kids. It'll be like 99.999.
Yes.
It's going to take an expert statistician like Martin to help us out with what the number really is.
So when it makes me very suspicious when I see news reports like this from NBC that are lying over the top, trying to scare the hell out of everybody. It made me super suspicious when I found out they were all lying to me about ivermectin and smearing people and trying to ruin their careers, like people like Joe Rogan and then people like me, after I started telling the truth about it. So I get really suspicious. But what makes me even more suspicious is that 2 years into the pandemic, they never talk about early treatment. So I know they suppress them, but they also never talk about things that are super important. Like you never heard Dr. Fauci tell you, make sure you have vitamin D3, your levels are up. Make sure you have vitamin K2. Make sure your zinc is up. Make sure vitamin C. Like, how important are those? I'm told they're super important. And why do you think they never mention them?
I mean, there's pretty good evidence on D. I mean, and it's in the medical literature. These are not controversial. I'll tell you, even drugs that are not at all controversial, that have been approved by the FDA for treatment, have been somehow made controversial. I'll give you a good example. Is monoclonal antibodies. Right in the summer wave, you saw Florida and some of the southern states getting hit. They were trying to use monoclonal antibodies, which had a 70% reduction in the mortality risk if you took in the first few days. And it was like the strange thing. It's like, oh, if you tell people that you can get treated, they won't get the vaccine. That's just backwards. When you have somebody that's sick in front of you, you should use every tool you have to try to make them better. Who cares if they had or had not had the vaccine? That just doesn't make any medical sense. It's not ethical. We should tell people, especially older people who are vulnerable, to get the vaccine. But at the same time, we should do everything we possibly can to develop and deploy early treatments that can save lives when a wave hits.
So, why do you think they don't mention vitamin D3?
I don't. Martin's going to let me do this. I think really the issue is the vaccine. Many people in public health have taken it into their heads that if people realize that there are some effective treatments available, if people realize that the death rate is not, 3.4%, 3 or 4%, or if they realize that, they may not demand the vaccine for themselves.
So that's what it appears to me. It appears that they for 2 years straight they've just said mass distancing vaccines. They've never mentioned monoclonals. They've never mentioned fluvoxamine, which I was on in that study. So there's lots of things that people could be doing. They never tell you to get your weight down. I lost 25 pounds, maybe 30 pounds during the lockdown. They never told people to do that because the 78% of the people who are hospitalized from COVID are obese. They don't tell you that either.
They closed playgrounds instead.
Yeah,
They did the opposite. They were putting people to stay home instead of being outside, walking or running or bicycling or hiking or canoeing or whatever.
So how do you think anyone will ever be held accountable for these lockdowns? Because I've covered them here and just how much poverty, it's 500 million new people thrust into poverty since COVID, and largely due to the lockdown policies that we've put around. I mean, this is a criminality on such a high level. Do you think people will ever wake up to the level of lies that they've been fed by big pharma through the media and through their capture? We all know the regulatory agencies are captured. The FDA, the CD, they're captured, right? It's called regulatory capture. And so do you think people will ever come to realize just the amount of propaganda they were fed around all this and how people like you were smeared who had the right idea?
Well, the Canadian truckers, they realize it, and many more, many nurses that I talked to know about it. So I think that gradually the public will understand this, and I think it's more and more obvious as people know that they get they get COVID even though they were vaccinated 3 times and have double masked, etc. So I think the public will understand this, and when the public understand it, the politicians sort of have to follow along, and then the media as well. And I think that the rank and file scientists, they already understand it, but the last people who probably is going to realize this or accept fault here are the people in science in leadership position like Fauci, or the editors of the big journals, or funding agencies, and the university presidents and the medical school deans. I think they're they're going to be the last one to sort of to accept the truth on this matter.
Another thing that they haven't mentioned in these 2 years of this pandemic, there was a study done that if we had Medicare for all, it would have probably saved 200,000 lives. That was that. So Dr. Fauci never mentions vitamin D3. He never mentions zinc. He never mentions early treatments. He never mentions monoclonals. They never mentioned that Medicare for all would be a big help right now in a situation like this. Never mentioned it, which lets me know that Dr. Fauci is 100% political actor, and that a lot of his policies are based on politics and not based on science or what's best for the people. So, like, for instance,
well,
go ahead.
If you go to, for example, Europe, the Scandinavian countries, Sweden, Denmark, Finland, Norway, they have all had among the lowest lockdown measures, but they also have among the lowest COVID deaths as well as lowest excess death. And I think one reason, of course, is that the lockdowns don't work in terms of reducing mortality. They're often counterproductive for all-cause mortality. But one thing that these 4 countries have in common also, they have very good health systems.
Yes.
And they have also a public health system that trusts the public, and therefore the public trusts the public health system. So I think, for example, Sweden and the other Scandinavian countries has been sort of not perfect by far, but they took a more sane, traditional approach based on basic public health principles.
I mean, just think about like what focus protection could have meant, right? So we organized home food delivery to young urban laptop class professionals, instead of organizing food delivery during times of high spread to older people living in the community alone, right? We decided that we were going to protect essentially people who like the higher upper class people, laptop class people who didn't lose their jobs, didn't lose a paycheck, instead of protecting the people that were the most vulnerable. And people lost their lives because of, we even and like just think, like we're talking about Medicare, older people, we sent people, COVID infected people, back to nursing homes, infecting all of the people there. We could have reorganized nursing home care so that older people, they're cared for by staff members who go actually work at lots of nursing homes. So they tracked COVID in and out. We could have reorganized it so that the nursing homes became a place where, it's essentially a sanctuary. Like you try to reduce the total number of people tracking in and out. You can have staff, pay them extra hazard pay to live there on campus for 2 or 3 weeks at a time, deploy testing resources. We could have mobilized we spent trillions of dollars. We could have mobilized it to protect the vulnerable. Instead, we mobilized to protect the laptop class.
And that's a function of politics and not science. And they knew this all along. And so here's another thing you never hear Fauci talk about 2 years into this, is that why haven't we added any ICU hospital beds? Because on the regular, we know that ICUs are overrun with the regular flu. In 2018, they were treating flu patients in tents from coast to coast in the United States. It was widely reported, but everybody has amnesia. And so 2 years in, we still don't have any extra ICU beds, and they are always blaming people who are unvaccinated for clogging up the hospitals. They don't blame people who are obese who won't stop eating cake. They don't blame diabetics who won't stop eating candy. They don't blame alcoholics who won't stop drinking. They won't blame smokers who won't stop smoking. They don't blame people who drive recklessly or rock climbers. It's only people who are unvaccinated who are going to clog up that bed, right? And by the way, they're never going to add another goddamn bed because they're not profitable, correct?
In medicine, we don't in the medicine that I was trained in, it was unethical, deeply wrong to blame the patient for being sick. You just care for the patient, whoever they are, whatever reasons, whatever decisions they made in their life that got them in front of you. That's the training that I received in medical school. And I think that seems to me like a really good principle of ethics in medicine, because you have to have patients trusting their doctors. Otherwise, medicine can't work. And what I've seen in the pandemic is this, basically, many people in medicine have thrown that away with this one class of people, the unvaccinated, as a set of second-class citizens. It's going to take a long time to restore the trust of patients and doctors because of this enormous mistake. You cannot demonize people for whatever decisions they make that lead you to needing care. You just provide care to them. That's what medicine is for. It should not be political. It should just be simply a matter of humanitarian, sort of applying science and the products of science to caring for the person in front of you who's hurting or sick or whatnot. That's it. That's all it should be. Not judgment, no shame, just care.
Yeah, we're repeating history here, but because 3 or 4 decades ago, we were blaming the sick who were sick of AIDS, and we were stigmatizing the gay community. Now we're also blaming the sick and stigmatizing the unvaccinated. So that's not public health, period.
So why do you think we don't have more ICU beds 2 years into a pandemic?
We spent $6 trillion. We sure could have. In fact, we've gone the other direction. New York State fired tens of thousands of well-trained nurses because they didn't want the vaccine because they'd already had COVID and recovered from it. So now they're short-staffed and they're canceling elective care. It is incredibly short-sighted. We should have demanded better of our political leaders. That is an excellent question, and there's no good answer to that question, Jimmy. We should have had more staffed ICU beds. We should have worked very hard to expand capacity, knowing that now there's this new infectious disease that's going to cause harm.
My theory is that ICU beds are not profitable and our hospital emergency rooms are staffed by private equity firms. And so we put our money where the profit is. We don't put our money where the need is. And then we have this dysfunctional healthcare system. And then people start blaming their neighbor for getting COVID and not being unvaccinated, instead of blaming this oligarchic system, which funneled $5 trillion upward to the richest people like Jeff Bezos while not adding one ICU bed. So that's my theory. Okay. I'll show you. I just want to show you a little bit more misinformation from the mainstream news media. Here's a senior producer over at MSNBC. He's mocking people who believe in natural immunity. He says, important note for the unvaccinated who believe in natural immunity. The first Omicron-linked death in the U.S. was recorded in Texas, Harris County. So that's a lie. That was not real. He didn't do any reporting on that. He's spreading misinformation. That guy didn't die from Omicron. That was a lie. And so he's also blaming and mocking people who couldn't believe in natural immunity. I guess that would include you two from Stanford and from Harvard, correct?
I mean, it's heartbreaking, actually. Like I think people trust some people. I've frankly started to trust less the folks on the news, and to see people present this kind of misinformation is shocking. I mean, I just say, like, you can get vaccinated, and you can get COVID and die. That has happened. That happens. It just does happen. You can be COVID recovered, and then get COVID again and die. That can happen. Lots of things happen in medicine. The question is how frequently they happen, and what can you do in your life to get control over it? How do you make wise decisions on the resources we have? Instead of panic mongering people, demonizing people like this, like we've done. Instead, if we said, okay, here are the tools you can use. Here's the real risk you face. And so for young people, we could have just helped them to have as close to near normal life as possible. We should never have stopped schools. I mean, think of how the poor kids that didn't get it has lost essentially 2 years of education. And for older people, we should have used the trillions of dollars to protect them. Why not?
I'm 100% with you. You tell me why not. Because, we live in a banana republic that's captured by corporations and the oligarchy, and we don't live in a democracy. And we leave it up to people like Anthony Fauci to tell us the truth when he's been a liar his whole life and a criminal. I don't say that lightly. Dr. Fauci should be in prison. He lied to Congress. At least I saw him do it twice. He lied about this. In a major shift, the NIH admits funding risky virus research in Wuhan, and he lied to Congress twice when he said that they didn't fund gain-of-function research. So this guy's a criminal. It's not even a close call anymore. Here's the first lie he told at the beginning of the pandemic.
Right now in the United States, people should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often, there are unintended consequences. People keep fiddling with the mask, and they keep touching their face.
And can you get some schmutz sort of staying inside there?
Of course. But when you...
So now there's a lot of people who probably thought he was telling the truth there. He admitted later the reason why he said that was because he was lying. That's
the irony, Jimmy, is that he was telling the truth.
So that's what a lot of people have said that too, that no, he was actually telling you the truth that time, and then he changed it and was lying later. So because his internal, the emails that got revealed showed that he was saying the same thing privately as he was saying publicly here.
There's a reason for that. Before 2020, there were dozens of randomized trials with masks, including N95 masks, cloth masks, and surgical masks in the community, in settings like in hospitals. And it is very difficult to find evidence from randomized studies, good randomized studies, that masks protect against viruses like in those contexts it was the flu, but the flu is similar in size and spread. It's spread by aerosols. So he was reflecting the pre-2020 consensus on masks based on a huge body of high quality research. He was telling the truth in that clip.
So when did the consensus change?
Sometime around April of 2020.
And
not based on any scientific studies. It just changed.
Why do you think it changed? Why would they change? Well, how do they own a mask making company? I mean, why would they? I don't understand why they would go from the pre-2020 consensus, which was no mask, to then a consensus of we need it. What's in it for them to do that if there's no science behind it?
I mean, I think part of... Oh, sorry. Go ahead, Martin.
Well, so to me, this is... I am asking the same questions because I'm a simple public health scientist. And there are no public health reasons for many of these things. So there are some political or psychological or sociological reasons for this. But as a public health scientist, I'm asking the same questions. I'm kind of stunned by it. And maybe you, as a journalist, might understand those aspects of society better than I do.
So I'm pretty sure I know why he was lying, but here he is admitting that he lied. They asked him about this, and here's what he said.
You shouldn't discount that. Now, getting back to your first question, which was what about a month or so or 2 or 3 ago when people were saying you don't really need to wear a mask? Well, the reason for that is that we were concerned, the public health community, and many people were saying this, were concerned that it was at a time when personal protective equipment, including the N95 masks and the surgical masks, were in very short supply. And we wanted to make sure that the people, namely the healthcare workers, who were brave enough to put themselves in harm's way to take care of people who were infected with the coronavirus and the danger of them getting infected, we did not want them to be without the equipment that they needed. So there was not enthusiasm about going out and everybody buying a mask or getting a mask. We were afraid that would deter away from the people who really needed it.
So I decided to lie. And either he's lying here or he was lying the first time. He's lying in one of those. And here he's admitting, he's saying, I lied. He's not using those words, but he's saying there wasn't great enthusiasm. But there was great enthusiasm for lying. And so either way, this guy's a liar and a criminal and should be in jail. Not leading our public health. Go ahead.
Like once you've lied like that, you're done. Like your credibility is shot, right? He basically is saying he's telling people scientific facts, or the way he tells them. He admits right there, in order to manipulate their behavior rather than to tell them the truth. There's not much in public health that you have. What you have is your credibility. Once you've shot that credibility for whatever purpose, in order to, in this case, to manipulate the public, I don't know why you would trust him again.
I can't believe that he still has his job. And I can't believe that I can believe that the big pharma funded establishment media doesn't hold his feet to the fire on this. No one's ever held his feet to the fire on this. And, they do YouTube. Fauci has made himself available to all these YouTube channels like myself. You can interview him. And they have that special row for it, right, when you log into YouTube. And except he'll never come on this show. That's why. So Fauci will never come on the show. Collins will never come on this show. They'll never come on this show because they know I know they're lying, and they know they know they're lying. So, and everybody else would know it too if they would watch it. So, I don't think I have anything. I think I've covered so what is the difference between this vaccine? Can you please explain? Because I get tired of trying to explain this to people. The difference between this vaccine or these vaccines for COVID-19 and the smallpox vaccine. Can you please explain the difference?
Sure. So a few things. Like smallpox is one of the deadliest viruses that have ever inflicted humans. For thousands of years, it killed countless people. The vaccines that were developed for smallpox were developed and tested over a long period of time in broad populations. One of the key differences, lots of differences, but one of the key differences is that the smallpox vaccine actually does sterilize the virus. So if you get the smallpox vaccine, you're not going to get and spread smallpox. The smallpox vaccine actually had had some side effects. It was not a benign vaccine, but smallpox was so deadly, especially to including to young people, that it was worth vaccinating large populations. Smallpox also doesn't spread it only spreads in humans. It doesn't have animal reservoirs. Unlike COVID, which dogs, cats, bats, deer all get COVID. And so smallpox was a perfect vaccine to use to try to eradicate this. That's the only human disease that we've ever eradicated. On the other hand, the COVID vaccine does not stop disease spread. You can get COVID even though you are vaccinated. That wasn't true for smallpox. So it's a very, very different sort of setting. Just because the smallpox vaccine worked to eradicate the disease, you couldn't use this vaccine to do that either.
So you could, because Dr. Robert Malone explained that you cannot vaccinate your way out of this kind of pandemic with a leaky vaccine. Leaky meaning you can still transmit and still contract the virus even if you're vaccinated. But, that doesn't happen with smallpox. What about polio? Is it so if I get a polio vaccine, can I still get polio? Can I still transmit it? Or is it? Go ahead.
We've almost eradicated polio. What's left, the variant of polio that's left is actually a live polio vaccine variant. So it's a complicated thing, right? Both polio and smallpox don't have animal reservoirs. Even if we had a perfect vaccine for this virus, we would still get it. The reason is simple: is because dogs, cats, other mammals get this virus. Unlike those other, this is not a good candidate for eradication. I would rather eradicate polio first.
And so, so you said in January of 2021, you figured out that this vaccine was not going to stop the transmission of it. That's when they.
No, Martin did. I thought it might. But it was sometime around March of 2021. I realized it wasn't stopping transmission.
But didn't you know before that it also had animal hosts?
Yeah. So in December of 2020, I wrote a piece arguing to use the vaccine for focus protection. Probably it does not going to surprise any of your guests. To use it to protect older people. I knew in 2021 and 2020 that this vaccine couldn't be used to eradicate the disease because of the animal hosts. So it should never have been used for that purpose to begin with. The right use of this vaccine was focus protection.
Okay. Because I've made the statement, and I don't know, so now I'm doubting it, that this vaccine doesn't stop transmission, doesn't stop contraction. I have to say it reduces contraction. I have to say that for sure. But I thought that they probably always knew this, but they didn't always know this. This was something we learned.
Yeah, in the clinical trials, they didn't even ask the question, which they should have done. They should have done the clinical trials so that they would know whether it reduces transmission or not. But that was by purpose by Pfizer and Moderna when they designed the studies, that they did not look at that question. So when FDA approved the drugs, we didn't know if it would reduce transmission or not. The hope was that it would. It turned out it didn't do a very good job at it.
Okay, because when I looked it up at the FDA website about transmission, it said, while most vaccines do stop the transmission of viruses, there's no evidence that says that this vaccine will reduce the transmission, although it is hoped it will. And that
Correct.
made me think that, well, the FDA never had any evidence that it did.
That's correct.
God,
and the difference was, so the end point of the trial was it stopped symptomatic disease. I thought, it's how big a leap is it to say that it also stops other infections at all? It turns out it was a big leap. And for the first couple of months after you're vaccinated, it does reduce infection rates, right? There's still, I think, a 70 up to the peak up to a 70% of efficacy against infection rates. But by 4 or 5 months afterwards, it drops very sharply. And by 5 months, it's the protection against infection is very, very small.
But now Omicron is here, and people have been reporting that Omicron presents as a much milder form of the disease. And in fact, some people have compared it to a cold. It presents as a cold. And a lot of people are saying that this could be the end of the serious pandemic, and we can get into an endemic, meaning where everybody's just going to live with it, and it won't be something that throws us for a loop. But what do you say about Omicron?
Yeah, so all pandemics end, and this one pandemic will also end. And it's correct that Omicron is less serious, but it's also much more contagious. So in that sense, it's worse. But because it's so contagious, people will now, almost everybody will get infected. And then that means that soon almost everybody will have natural immunity, which means that the pandemic ends and we will go into the endemic stage. So, but one reason why we get these more contagious ones is because of the lockdowns. So the lockdowns there will always be mutations. But what happened was, because of the lockdowns, we sort of pushed things into the future where we will have a more contagious variant. And first, Delta was more contagious because the only way a new variant can sort of take over is to be more contagious. So Delta was more contagious, and then Omicron much more contagious than Delta. And that means that the more contagious it is, the threshold needed to stop the pandemic, the herd immunity threshold, is higher. So we don't know exactly what the percentage is, but from the original version, maybe the threshold was 60, 70%, something like that, who knows? But now with Omicron, it's certainly above 90%. So by doing these lockdowns, we push things into the future, but we also ensure that there will be more contagious variants, which means that the proportion of the population that gets infected before it ends, before we end the pandemic and go into endemic stage, is going to be much higher. And that means that it makes it also more difficult to protect those high-risk older people who we really should have focused protection on.
And it also makes me suspicious that when the WHO recommends against boosters in first world countries because they would reduce the amount of vaccines available for third world countries, and Big Pharma and Bill Gates, they don't seem to give a crap about that at all. And that also makes me suspect that these people who are pushing this aren't really that interested in eradicating this or trying to control this or handle it. They have a different motivation. Does that also make you suspect?
I mean, if they were going to be, I think the right policy should have been to get rid of the patent protection for this vaccine. The vaccines were developed with technologies developed with public monies. In this one case, for sure, at least, the vaccine manufacturers also push through contracts that essentially make it so they don't face liability for vaccine injuries like they normally would. And country after country, they basically were forced to sign this kind of contract in order to have the vaccines enter at all, like the mRNA vaccines enter at all. So now you have this very strange thing where like the rest of the world has a very different vaccine than the richer countries have. The vaccines are like the ones we use are like very expensive, but not to patients, but like in terms of like per dose compared to some of the other vaccines. And yet there's lots of people in the United States who would like to actually have some of the more traditional vaccines that are used in use more broadly outside the US. So I don't, it's a very weird kind of pharmaceutical economics thing going on here. And it hasn't really served the population well. And then there's this push for the boosters as if the boosters were going to solve the transmission problem, which it's not. Meanwhile, as Martin said, there's still so many poor older people living in poor countries that would benefit from having these vaccines. You hear this phrase, "We're all in it together." I'm sure you've heard this and it's just a lie.
Yes.
Like you can see that it's just a lie.
What do you say to people who say, I got to get my kids vaccinated so they don't infect their grandparents? And I'm like, well, I say, why don't you give their grandparents the vaccine? What do you say?
I completely agree. The vaccine is going to protect the grandparents from severe disease and death. Kids are not the primary vectors of spread of this disease. It's not like other colds and other things. I mean, I just say, making kids feel guilty about spreading it. How wrong is that?
I couldn't agree more. They're making people. I've seen reports of people who got COVID and they felt guilty, like they were ashamed. They were ashamed that they got a virus. This is real. This is what's happening. And do you? So I guess I appreciate you giving me all this time. I'll have two final questions. What would you recommend we do going forward now?
We need to get back to normal and have all the schools and universities and workplaces open. Stop putting masks on children in the schools. Let them live a normal life, socialize, spend time with their friends, do their extracurricular activities, and so on. And I think that we have gone through sort of a traumatic 2 years. We have to help each other. And many people are afraid. And I understand because of the enormous propaganda that has been thrown at them, that they need to be super afraid of this virus. And well, if you're 78 years old, then you should be concerned, but not if you're a child or a young adult. So we have to sort of try to help overcome this and help each other in the families, with neighbors, people we work with or study with, people we are in different organizations, to sort of try to come together. And I think the artists have an enormous important role in doing this, whether they are musicians or actors or painters or writers, because it's culture that sort of helps us heal and helps us be together as a community. So I think the artists have an important role to help us heal after these 2 years that has been, I think, devastating for many, both in terms of the physical health, but also mental health. So what it was supposed to be 2 years, but 2 weeks to flatten
The curve.
the curve. Instead, we got 2 years to flatten the children and the working class and the vulnerable. And that's tragic. So now we have to try to recover.
Can I just make one plea? There's so many people, I think good people, that they didn't know what the facts were, and they were trying to be public spirited, and they acted in ways out of fear. And I think for most people, I think if you have people in your life that have like done weird things because of that fear, I would ask that you forgive them. That's what I'm going to try to do myself. We do need to hold responsible the people that did this. I don't know about jail, but I will say this: there has to be a reckoning so that this never happens again. This will not be the last pandemic in our lifetimes. And when the next pandemic happens, we have to allow scientific discussion and debate. We cannot have propaganda rule, and we have to use the resources we have to protect the vulnerable, no matter who the vulnerable turn out to be. So that discussion needs to happen cleanly at the top. So and holding people who made these mistakes responsible for these mistakes. I'm not necessarily in favor of jail, but I'll say at the very least, an acknowledgement that these mistakes created so much damage, so that we don't make them again. It has to be a central part of our discussion going forward.
Dr. J. Bhattachara and Dr. Martin Kulldorff are the co-authors of the Great Barrington Declaration, which calls for no lockdowns and targeted protection for the vulnerable. That was too dangerous of a message to debate in science, and so it was dismissed, and it was censored, and it was smeared. And so I always want to say thank you for doing that. Thank you for coming on and explaining everything. Thanks for not backing down and going along with the herd mentality. I appreciate you both. Thank you very much.
Thank you, Jimmy.
Okay.
Thank you, Jimmy. It's a great pleasure talking to you.
Okay. Hey, we're doing live stand-up shows in Los Angeles, February 5th, February 12th, February 18th, February 20th, we're in Philadelphia, and then February 26th, back here in Los Angeles in Studio City at our 60-seat theater. Go to jimmydorecomedy.com for a link for all tickets, and while you're there, become a premium member, get access to all our premium content.